9. Explain the difference between acute and chronic health effects. Acute effect is an immediate or rapidly produced adverse effect following single or short-term exposure to an offending agent which is usually reversible. Chronic effect is an adverse health effect produced as a result of prolonged or repeated exposure with a gradual or latent, and often irreversible, effect that may often go unrecognized for a number of years. 10. Identify the factors affecting the suitability of respiratory protective equipment. Concentration of the contaminant and its hazardous nature. Physical form of the substance, for example dust or vapor. Level of protection offered by the UPE. Presence or absence of normal oxygen concentrations. Duration of time that it must be worn. Compatibility with other items of PPE that must be worn. Shape of the user's face and influence on fit. Facial hair that might interfere with an effective seal. Physical requirements of the job such as the need to move freely. Physical fitness of the wearer. 11. Identify factors that could reduce the effectiveness of local exhaust ventilation. Poorly positioned intake hoods. Damaged ducts. Excessive amounts of contamination. Ineffective fan due to low speed or lack of maintenance. Blocked filters. Build-up of contaminant in the ducts. Sharp bends in ducts. Unauthorized additions to the system. 12. Outline 2 types of cellular defense mechanisms that the body has as a natural defense system. Respiratory defenses. The respiratory system is made up of the nose and nasal cavity, windpipe, trachea, and lungs. The air passes down the bronchi and bronchioles to the alveoli. These are small air sacs and are the area where oxygen enters the bloodstream. The respiratory system is protected by the following defenses. The sneeze reflex, filtration in the nasal cavity, which has a thick mucus lining that particles stick to. This is very effective at removing large particles. Only particles less than 10 microns in diameter pass through. Ciliary escalator, the bronchioles, bronchi and trachea are lined with small hairs, cilia. Mucus lining these passages is gradually moved by these cilia and up out of the lungs. Any particles trapped in this mucus are cleaned out of the lungs by this mechanism. This filtration mechanism is effective at removing all particles larger than 7 microns in diameter. Macrophages, scavenging white blood cells that attack and destroy particles that lodge in the alveoli, where there are no cilia to extract them. Skin defenses. The skin forms a waterproof barrier between the body and the outside world. It is made of 2 layers, the outer epidermis and the inner, thicker dermis. Defense mechanisms include a thick layer of dead cells at the surface of the epidermis that are constantly being replenished as they wear off. Sebum, an oily fluid secreted onto the surface of the skin that has biocidal properties. 13. Give the meaning of the term maximum allowable concentration. The maximum exposure to a biologically active physical or chemical agent that is allowed during an 8-hour period, a workday, in a population of workers, or during a 24-hour period in the general population, which does not appear to cause appreciable harm, whether immediate or delayed for any period, in the target population. Or, exposure concentration not to be exceeded under any circumstances. 14. A. Explain the health risks associated with exposure to the Leptospira bacteria. The disease leptospirosis starts with flu-like symptoms, fever, headache, and muscle pain, and then progresses to a more serious phase involving jaundice. At this stage the disease is causing liver damage and may be known as Weil's disease. If diagnosed early, the disease is usually treated successfully. It can prove fatal, especially if diagnosed late. B. Identify the workplace circumstances where Leptospira bacteria may be present. Leptospira bacteria commonly infect animals such as rats, mice, cattle and horses. Infected rats pass the bacteria in their urine, perhaps onto wet surfaces or into water where the bacteria can stay alive. If contaminated water comes into contact with cuts or grazes, or is ingested, then infection may occur. Occupations at risk are those who work with potentially infected animals, for example dairy farmers, or in wet areas where there may be rats, for example sewer workers, water sports instructors. C. Identify precautions that will reduce the risks from exposure to Leptospira bacteria. Preventing rat infestation, by good housekeeping and pest control. Good personal hygiene, for example hand washing. PPE, especially gloves. Covering cuts and grazes. Issuing workers with an at-risk card to be shown to the worker's doctor, physician, to allow early diagnosis. 16. A dust produced during a work process contains a substance that is classified as toxic and has been assigned a workplace exposure limit. A. Give the meaning of the term toxic. Toxic, small doses cause death or serious ill health when inhaled, swallowed or absorbed via the skin, for example potassium cyanide, KCN. B. Give the meaning of the term workplace exposure limit. Maximum concentrations of airborne contaminants, normally measured across particular reference period of time, to which employees may be exposed. C. Identify the limitations of will. 6. Whenever exposure to the hazardous substances is such that an identifiable disease or adverse health effect may be linked to the exposure. Whenever there is an increase in registration of occupational illness and health cases at a workplace with a probability that the work is affecting the health of employees. After there is a change in the work activities and these activities pose additional hazards to health of employees working in the hazardous environment. Whenever the local exhaust ventilation systems installed is working effectively. After a major accident which has caused the employees to be exposed to hazardous environment above the permissible limit. After the independent third party carrying out health surveillance at the workplace and shows that the exposure limits are above maximum allowable concentrations. 17. Asbestos is to be removed from a building used as a workplace. A. Outline the difference between acute and chronic health effects. 4. Acute effect, an irreversible and immediate or rapidly produced adverse effect, when exposed to single or short-term exposure. Chronic effect, an exposure which is usually prolonged and repeated which can lead to various health effects like noise-induced hearing loss is known as chronic effect. B. Identify the possible chronic health risks from exposure to asbestos. Asbestosis. Lung cancer. Mesothelioma. C. Outline where asbestos may be found within the building. Roofs, asbestos cement. Ceilings, ceiling tiles. Floors, floor tiles. Pipes, downpipes. Decorative plasters, Artex. Insulation, pipe lagging. D. Outline control measures that should be considered before and during their removal of asbestos. Provide personnel protective equipment and respiratory protective equipment. Information to give and to appropriate legal and other interested agencies. Ensure adequate supervision is maintained at all times. Contaminated air needs to be collected without allowing it to escape to outer air. Monitoring of work exposure limit as per standard. Ensure appropriate local exhaust ventilation is provided throughout the job. Regular monitoring of air quality to be done. Only competent and trained personnel to do the job. All workers are subjected to health surveillance at regular intervals and recorded. Accumulated wastes are to be collected only in the designated waste bags with correct identification.